So let's talk about depression a little bit, trying to explain what it is. And it's multifactorial, multifocal in the brain. There's obviously a lot that we don't understand, a lot that we don't understand about the neurochemistry as well. What we do understand using brain imaging techniques is that an area of the brain, which is a primitive limbic area, so it's an area that we've inherited from from the lizards. That area is the valence area of the brain that tells us, wait a second, that's someone, that person that's entering the room, that's a potential threat. Or walking along the sidewalk, who is this person that's approaching us? Is that someone that could be potentially injuring us or trying to assault us, etc. So that valence area in the brains of patients with depression is hyperactive. So everything that that patient sees in the environment is perceived as a danger, as a threat. If the frontal lobe is working in its normal fashion, the frontal lobe, this prefrontal cortex, tells this primitive area, the limbic area, the anterior cingulate cortex, hold on, everything's okay. That person walking along the street is just passing by. That person in the restaurant is just someone looking to grab a meal. That car that's approaching is not going to hit you. And if the frontal lobe is not functioning adequately, then that limbic area is hyperactive, causing a lot of difficulties for the patient or an individual. The purpose of TMS is to strengthen that frontal area, to reinforce the activity of that frontal area, to communicate with the limbic area and say, it's all okay, go about your day, this is not a threat, go on to the next activity, don't dwell on that. And so knowing that that pathway is existing is very powerful. Given the fact that we have these brain imaging techniques, we can see that pathway. We can see the effects of TMS too. We can see that TMS is acting to reinforce that pathway. And so it started with knowing that pathway. Once we know the pathway, we have a neuromodulation device, a technique to intervene in that pathway, and so we can achieve an outcome that's satisfactory to us. And we do see, again, changes in that pathway. It's very impressive that we see changes in that connection pathway that improves the outcome of that circuit, makes people feel happier, improves their mood, etc. And it's a very powerful tool.